The coronavirus pandemic is an ongoing pandemic of coronavirus disease, COVID-19, caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. The outbreak was identified in Wuhan, China, in December 2019, declared to be a public health emergency of international concern on the 30th of January 2020, and recognized as a pandemic on the 11th of March 2020. As of the 11th of April 2020, more than 1.69 million cases of COVID-19 have been reported in 210 countries and territories, resulting in more than 102,000 deaths. More than 376,000 people have recovered. The case fatality rate was estimated to be 4% in China, but varies significantly between countries. The virus is mainly spread between people during close contact, often via small droplets produced during coughing, sneezing, or talking. While these droplets are produced when breathing out, they usually fall to the ground or surfaces rather than being infectious over large distances. People may also become infected by touching a contaminated surface and then their face. The virus can survive on surfaces for up to 72 hours. Coronavirus is most contagious during the first 3 days after onset of symptoms, although spread may be possible before symptoms appear and in later stages of the disease. Common symptoms include fever, cough and shortness of breath. Complications may include pneumonia and acute respiratory distress syndrome. The time from exposure to onset of symptoms is typically around 5 days, but may range from 2 to 14 days. There is no known vaccine or specific antiviral treatment. Primary treatment is symptomatic and supportive therapy. The cardiovascular complications of the newly coronavirus COVID-19 is almost similar to severe acute respiratory syndrome coronavirus, SARS-CoV. Recommended preventive measures include hand washing, covering one's mouth when coughing, maintaining distance from other people, and monitoring and self-isolation for people who suspect they are infected. Authorities worldwide have responded by implementing travel restrictions, quarantines, curfews, workplace hazard controls, and facility closures. The pandemic has led to severe global socioeconomic disruption, the postponement or cancellation of sporting, religious, political and cultural events, and widespread shortages of supplies exacerbated by panic buying. Schools and universities have closed either on a nationwide or local basis in 193 countries, affecting approximately 99.4% of the world's student population. Viruses cannot live without a host, they need a living creature to help them multiply. All they have is a protein coat and a core of genetic material, either RNA or DNA. They can only reproduce by attaching themselves to cells. In most cases, they reprogram the cells to make new viruses until the cells burst and die. In other cases, they turn normal cells into malignant or cancerous cells. Also, unlike bacteria, most viruses do cause disease, and they're quite specific about the cells they attack. Bacteria, instead, are relatively complex, single-celled organisms that they can reproduce on their own. Fossilized records show that bacteria have existed for about 3.5 billion years, and can survive in different environments, including extreme heat and cold, radioactive waste, and the human body. Fewer than 1% of bacteria cause diseases in people. Most bacteria are harmless, like the ones living in our stomach and help us digesting food. There are no specific antiviral medications approved for COVID-19, but development efforts are underway, including testing of existing medications. Taking over-the-counter cold medications, drinking fluids, and resting may help alleviate symptoms. Depending on the severity, oxygen therapy, intravenous fluids, and breathing support may be required. Several compounds that were previously approved for treatment of other viral diseases are being investigated for use in treating COVID-19. The World Health Organization also stated that some traditional and home remedies can provide relief of the symptoms caused by SARS-CoV-19. Strategies for preventing transmission of the disease include maintaining overall good personal hygiene, washing hands, avoiding touching the eyes, nose, or mouth with unwashed hands, and coughing or sneezing into a tissue and putting the tissue directly into a waste container. Those who may already have the infection have been advised to wear a surgical mask in public. Physical distancing measures are also recommended to prevent transmission. Many governments have restricted or advised against all non-essential travel to and from countries and areas affected by the outbreak. This may not be enough, as the virus is already spreading within communities in large parts of the world, with many not knowing where or how they were infected. Healthcare providers taking care of someone who may be infected are recommended to use standard precautions, contact precautions, and eye protection.